Hello everyone. In this video, I want to share some current information with you about tiptoe walking in children. Toe walking is a common pattern that often seen in walking of children, and it can cause distress and anxiety for the parents of those children. Why do children walk on their tiptoes? What are the reasons for walking on tiptoes? What are the treatment options for children who walk on tiptoes? Healthy children usually take their first steps and start walking around 12 to 13 months after birth. Our feet support the weight of our body. When we walk, the foot flexes from the heel to the toes. With each step, our toes help push us forward when we walk. Actually, every child walks in his or her own way.
What influences a child's ability to walk?
There are many causes which can affect a child's walking. If I share this list with you, the child's genetics, if the child is active or not, whether the child is overweight, any illnesses the child has had, exercise level and previous walking experiences. These factors all play a role when a child starts to walk. If a child is still not walking by 15, 16 or 17 months, the parents should be concerned and look for professional help.
Do children who walk on their tiptoes have a genetic predisposition?
Walking on tiptoe is a common pattern in childhood. Well, research have shown that children who walk on their tiptoes often have family members with the same problem to varying degrees.
What is the frequency of tiptoe walking in male and female children?
Well, studies have shown that tiptoe walking in children is more common in boys than in girls. Families often complain about that their children walk on the tips of their toes. Even though the children correct their steps after warning from the parents, they continue to walk on tiptoe afterwards.
What are the reasons for tiptoe walking in children?
The most common condition is the idiopathic tiptoe walking, which is a habitual gait with no apparent cause. Some kids who start walking on their tiptoes make it a habit. Another reason is tightness in the Achilles tendon. This tendon is connected to the calf muscle, which helps us push off the ground with our feet. Tightness in the Achilles tendon at the back of the heel can cause some kids to walk on their tiptoes. Disease in a child's foot and ankle bones can also cause this problem. Another reason for toe walking in children is neuromuscular conditions. Some examples of this disease are viral infections that a child may have experienced, brain injuries from different causes, conditions such as cerebral palsy, muscle disorders like muscular dystrophy and myopathy. Walking on tiptoes is also commonly observed in autistic children.
What is the treatment for walking on tiptoes in children?
If a child is still walking on their tiptoes at age 2 to 3, they definitely need to be checked out. The most important thing in planning treatment for a child who walks on their tiptoes is to make sure the diagnosis is accurate. The main reason should definitely be identified first. So, it's better for a doctor to evaluate the child and then provide treatment. If it is idiopathic, it can be observed. If kids walk normally sometimes and on their tiptoes at other times, it's useful to keep an eye on them. If a child is constantly walking on their tiptoes, that means there is a problem and treatment must be started immediately. If a child is still walking on their tiptoes all the time, they should not wait too long to get treatment. First, it is important to say this: early diagnosis and early treatment are extremely important. As the child gets older, the bones in their feet get stiffer. Also, the cartilage in the feet gets harder over time. The ligaments and other tissues in the feet lose their flexibility. All of these make the treatment harder.
What kind of treatments are applied for children who walk on their tiptoes?
If a child is still tiptoe walking consistently by age 2 to 3, they may need physical therapy, stretching exercises, strengthening exercises, using splints and braces, Botox treatment applications, and also using orthopedic shoes. If these treatments are not sufficient, serial stretching casts may be used. If a child is walking on their tiptoes because of a neurological condition, they should get help from a pediatric neurologist, and the treatment should be planned accordingly. If the treatments are not successful, or in severe cases, surgery may be necessary to treat the condition. In surgical treatment, operations can be carried out to loosen the muscles or tendons at the back of the lower leg. The important thing here is to ensure that the loosening or lengthening of the muscles is done the right way. I recommend that families work closely with specialists on their child's tiptoe walking problem and foot health. I wish you all good health.